next up is Miss Dionne Sinclair. She is the Vice President of the Clinical Care and Chief Nurse Executive at the Center for Addiction and Mental Health. Ms. Dionne plays an integral part in helping the organization achieve its goals through the integration and equitable care and support for people with mental health illness. She leads the program that supports those with the most complex illnesses and is dedicated to improving access to excellent patient-centered care so that people may live better lives. Ms. Dionne is also a member of the Registered Nurses Association of Ontario, the Black Nurses Task Force, and an active member of the College of Nurses of Ontario's Employers Reference Group. I welcome you, Ms. Dionne.
Okay, thank you very much. And I just want to say it's a privilege to be here. Dr. Ahmed and Dr. Cristobal, you absolutely moved me with those facts that you've shared, and everything you said is correct. Also, Dr. Adawe, I'm just honored to be a part of this. So thank you so much for inviting me. I would like to share my screen, and I'm going to share a little bit about myself, and it's called resiliency because yes, there is gender inequality. There is, it will be, and we're working to narrow the gap, but what do you do with what the facts are right now? So I'm going to tell the story of this little immigrant kid from Jamaica. Her name's Dionne. And the first picture I'm going to bring everyone over to is a picture that most immigrants, if you came to Canada in the 60s or 70s, you have this picture. In my class, that's me. And the only other Black child in class with me is my brother, Steve Sinclair. We grew up in London, Ontario, 1976. And again, you're in that immigrant home. The only thing I can say is Jamaica is one of those islands, I call it, it's matriarchal. So the women, they control a lot of the power, property, and the social privilege a lot of women have. So you're a strong woman when you're coming from Jamaica. There may be some Jamaicans here. Down at the bottom, and if everyone can see this, take note, that's me graduating from nursing in 1986. There is one male in the class, and that's Mr. Corbett. He was actually our teacher, I think one of the first male nurses. Gender inequality also works in reverse when you think all these women are nurses and we're all the male nurses. Now that is equalizing. However, as a nurse, you're the caregiver. And if you're the nurse in the family, you know that everyone calls on you if they've got a rash, if something hurts, if they're sore, which is fine. I love being a nurse. It's a passion of mine, and I'm still nursing today. What I wanted to share though was growing up in high school, I was told, oh, you better get your education while you're here. You have a strong accent and you're probably not college or university material. That's something that happens to a lot of immigrants when you're told that this is all you can be, or there is an opportunity there for you. Again, I want to point to the middle here, who's my superhero, which is my mom. And my mom really told me, Blossom Sinclair, you don't believe that. You can do and be anything you want to be. Also growing up in Jamaica, I saw that for a fact. Prime Minister is Black. All my teachers were Black. Butcher, baker, candlestick maker, anyone who owned a business, they're Black. So no one could tell me, no, I couldn't be anything I want to be. My mom, with her encouragement, I went on. This is me graduating from Fanshawe College, London, Ontario. That was 1988. She put me in Army Cadets where I learned a lot of leadership skills, and it also helped with a mom raising 4 kids. We didn't have that much, extra. So being a part of Army Cadets, I was able to go away to summer camp and be a part of an organization that really did teach you how to be a leader. I'm sharing this picture right here. That's me in Jamaica, and my brother Steve, again, the same one over here, my sister Orlean. We have another brother, Ian, but that's us 43 years later, recreating this picture. I'm gonna come back to it just to tell about how mental illness can impact a family. That's me graduating from my master's at York University. I really want to find that guidance counselor who told me I'm not college or university material, because after graduating high school as an RPN, going to Fanshawe College, getting my diploma RN, I've since went on to University of Western Ontario, Bachelor of Science in Nursing, York University, Master's in Nursing, completed a Master's in Health and Min. Why am I saying all this? Yes, there's gender inequality out there. Yes, the world will not be fair to you as a woman. Yes, you're going to have more responsibility, more times than the males in your life, and you're going to be looked on by others in your family to also help them out. I can say I'm a single mom, 3 kids. There they are right here. This is Althea, Pamela, and Brianne. I will tell you about Althea. She's now a registered nurse. She went to Queen's University. While as a single mom, while going back to school myself, I encourage my girls to keep going and go back to school. Again, I'm saying that to give some hope. The facts are the facts. They're pretty dire. And it is true, around the world, women and girls suffer from a lot, but also it's true that women and girls are some of the toughest human beings on the planet, and we overcome and we persevere and we adapt and we keep going. So I want everyone here listening to my voice to know that you can overcome, persevere, adapt, and keep going, because sometimes you don't have a choice. And I have 3 girls. I came from a Black woman. I gave birth to Black women, and I tell them, keep going. So Althea is a registered nurse. Pam in the middle is a social worker. Brianne on the end works for TD Bank. She's an actuary. And they were raised by a single mom. They're phenomenal women. I'm so proud of them. This is me in one of my roles as a director of medicine. That was at South Lake Hospital. Now from my introduction, you hear I'm the vice president, clinical operations, chief nursing executive at the largest mental health hospital in the country. It is actually internationally renowned. It's an academic health science center. So how did this little kid from Jamaica, this one right here, started out as an RPN and is now the vice president of operations, the second to the CEO at a hospital? Hard work, dedication, perseverance, stick-to-itiveness. I don't like the word resilience anymore because we're all told to be resilient, but you know what? You have to be adaptable. You have to be able to move from tables where respect is not being served. And if anyone tells you you can't, you need to go out there and prove them that you can. So here's one of the things I'll bring back to mental health, that a lot of women, we suffer in silence when things happen to us. When things happen to our family, I think it was Dr. Ahmed who said, sometimes we internalize things because we don't want to be judged. We don't want to have a stigma attached to us, and then it impacts our jobs or things like that. My brother, Steve, you see this picture? Remember, we're like this because the 2 of us went through all of primary school, middle school, high school together. 3 months after this picture, my brother Steve was shot and killed by a 15-year-old. It actually made national news. We were this close. Losing my brother was one of the toughest things that happened. And as the nurse in the family, who had to console everyone else? Who had to make sure mom was okay and dad was okay and my sisters were okay, brothers were okay, his kids, making sure they're okay. He died and left 5 kids and 1 grandchild. And at the end of the day, I'm looking at myself in the mirror and had to reckon with myself saying, you are not okay. When I'm alone, when I was by myself, all the flowers are gone, all the condolence notes are gone. You're left alone to deal with that emptiness. And you have to be strong enough to say, it's okay to be not okay, but if you need help, go seek help. We're not superwomen, and it is okay to reach out to other sisters for help. It is okay to reach out to your tribe for help, co-workers for help. At CAMH, we have Access CAMH. If anyone needs help, you can reach out there. I just want to say I needed help. I reached out for help. I share that with everyone to say, me too. It's okay to say, I've been impacted by something traumatizing, something traumatic, and I wasn't okay. I went and got help, people to talk to, people who listened, people who understood, and I'm much better for it. But I want to share that with everyone so they can say, hey, the vice president and chief nurse at CAMH went and got help. So can I. We're strong enough to overcome a lot. We still have to overcome a lot. My girls will have to overcome a lot. But if they do need help, I want everyone listening to my voice know that you can go seek help. And it's okay. It really is okay. That's how we break the stigma. You have to share. We're not superwomen. Okay? So that's what I wanted to share. I wanted to share some hope. You can go from RPN to vice president. It is possible. Even when you're a single mom, 3 kids, no child support. Very possible. Hard work, a lot of hard work. However, if you do run into areas where you do need to seek help, it is still okay to do that too. All right? Thank you very much, everyone. I'm going to stop sharing.
Thank you so much, Dionne, for that really powerful presentation. And thank you for all the work that you're doing and coming here today to talk, because I think one of the most powerful things we can do as women of color is show up and speak in front of other women of color and share our stories and be an example. And thank you for your message around it's okay to get help. That's a very important message, and coming from somebody who's been as successful as yourself, that's like a great message. So thank you. I'm in therapy. I love it. So I resonate with your message. So thank you.
Next, we have a question for Dionne Sinclair. The question says, who are the trained experts I can talk to when I feel the need to get the burden off my mind? And I feel this would be perfect for her as this is her field.
It is my field, but I'm not one of the trained experts. The first thing I would say is speak to your family doctor, your health practitioner. They can refer you to a psychiatrist. The great news is that CAMH has an emergency department. 24/7, it's open. If you need to be assessed by a psychiatrist, you come to Emerge, you will be assessed. I'm not saying you will be admitted or treated there on the spot, but they do refer you. There's outpatient clinics. The other place is Access CAMH. Actually, I'll look for it and post that Access CAMH link in the chat, where again, it's one door to many services. Once you click on Access CAMH, it will lead you to where you want to go, which is really good. So you don't have to start searching. You go through the one door, and then depending if it's addictions, different type of mental health services you need, you can go there and look. But start with your family practitioner. If you don't have one, there's walk-in clinics or clinics you can go to. There's nurse practitioners led clinics, and they can refer you on. But without fail, CAMH has an emergency department open 24/7, and other hospitals also through Emerge, they usually have mental health departments as well. If it's someone, if you have funds, because this is the sad part about mental health care, private therapy costs money, and single moms with kids, sometimes that's not affordable. So if you do have what benefits that can provide that, that's something to look into. But again, start with a family practitioner or a clinic they can refer you on. And there should be free government assistance. I don't have those at the tip of my tongue, but you can always look those up as well.
Thank you, Dionne. That's great advice.